If decay penetrates through the enamel, the decay may then reach the nerve. Once it penetrates through the enamel, reaching the dentine, which is the inner substance of the tooth, the decay will rapidly spread because of the dentine's softer nature. The decay will transfer to the pulp cavity through minute tubules on the dentinal surface. Once it reaches the nerve, it will cause an inflammatory reaction, causing a toothache. Gradually it will kill all the nerve tissue, forming an abscess in the periapical area, which means the area near the tip of the tooth. This will cause another massive toothache.
Good evening. Welcome back to Health Talk. I'm Dr. Kenneth Levine. I'm here with Dr. Brad Ginzler. You know, I was at breakfast this morning, Brad, and I have a bad habit of chewing ice. And
it's dangerous.
That's dangerous, right? It can lead to cracked teeth. You want to talk a little bit about that?
You know, I see it in my practice daily, I would say. A patient comes in with toothache-like pain, and it's difficult to diagnose sometimes. With transillumination, lighting the tooth, we can sometimes visualize cracks. And as we had touched upon, using a microscope, I can explore the extent of those cracks. Really, the length and the distance that the crack extends into the tooth is going to ultimately determine whether or not that tooth has savability and can be preserved long-term. To tie in a little bit of the discussion with the cone beam scan that we had talked about as well today, I can sometimes take a scan on a patient that has a cracked tooth, and I had a gentleman came in today. It was tooth number 18. Pain was very localized.
It's the lower left molar for our viewers, right?
Correct.
Okay.
Sorry. To me, this is a tooth that, even though it has no other restoration, it's not a tooth that I think should be preserved. I actually recommended that the gentleman have that tooth taken out today. And again, I think that that's something that is hard to predict ahead of time. Right. The cone beam helped that diagnosis, and chewing ice may have been a factor.
Right. Well, chewing ice, I know I've been told by everyone, makes your tooth older, right?
Right.
Let's talk about how it makes your tooth older.
You know, the wear and tear on the teeth over time when you're eating harder foods. Your jaw is a hinge axis, right? So the chewing surface in the back teeth, the molars, those teeth are taking the most force of your chewing. If you're over placing force on these teeth, you have the potential to crack these teeth.
But there's another aspect, isn't it, of the pulp receding in response to the cold? As you chew ice, it stimulates the pulp to recede, or is that an old wives' tale?
Well, certainly any continual trauma to the nerve is going to cause that pulp to try to protect itself.
Thermal or physical?
Correct.
Okay.
So even if it's a deep restoration, you're going to cause that pulp to have some reactivity to it and try to make itself smaller.
Before we go any further, I want our viewers to know where they can find you. So talk about where your office is located, phone number, address, website, things like that.
Absolutely. I'm in Coral Springs on University Drive. I'm between Sample and Royal Palm Boulevard. My address is 2929 North University Drive, Suite 102. I can be found on the internet. My website address is www.ginzlerendo.com. Ginzler Endo, one word.
Ginzler Endo, one word.
Yep.
That's a mouthful.
That is.
Okay. You know, in dealing with dental specialists, for us in my practice, it's a team approach.
Sure.
As a periodontist, I work with fine restorative dentists, whether they be general dentists or prosthodontists, work with orthodontists. I get to work with endodontists. You know, for the first time in my career, I have to look outside the four walls of my office for an endodontist. I'm very happy that I found you to work with. It's been a joy for me. You know, in my practice, we made a decision years ago that we're able to have more people come into the office to find out what's going on by offering complimentary exam, consults, and radiographs, so that financial barrier is taken away from patients who want to come see me. In my office, you know, we've been in here in Tamarack now for 38 years. And I look forward to the next 20 years because this is a very exciting time for us. You've been in your office how long now?
I've been in my own office for a year and a half now. I've been a practicing endodontist since 2004.
Okay. In dealing in your own office, do you find that you must have a lot of interaction with restorative dentists?
Certainly.
Okay.
That's where most of our patients tend to come from.
Do you have a situation sometimes where patients have their root canal started by the dentist and then they come to see you in the middle?
Oh, absolutely. And yeah, I actually like that scenario the least, unfortunately.
Oh,
it
sure.
makes my job a lot more difficult.
I know, because they've already been to the dentist, usually they're uncomfortable, and they now have a situation where they have to go somewhere else, and why they need to see you, right?
Yep. Yeah.
Well, I'm sure the dentist and the patients appreciate your efforts. Again, I'm Dr. Kenneth Levine with Health Talk. I look forward to seeing you soon. Have a good night. Thank you.